Hi everyone, I'm Dr. Babita and in today's video we will discuss Park's 3-step test. Park's 3-step test is a confusing topic, so we will go slow. We will discuss each step in detail, taking the example of different clinical case scenarios so that we are able to actually understand what is going on instead of, just blindly memorizing everything. And of course, towards the end of this video, I will tell you a shortcut on how to remember this test for your exams and clinical rounds. But first, we will go into the details of this test, so let's begin. Park's 3-step test is done to diagnose a single cyclovertical muscle palsy. What does that mean? What is a cyclovertical muscle? Cyclovertical muscles are those muscles that produce torsional eye movements, that is why cyclo, as well as vertical eye movements. Vertical eye movements are elevation and depression. The muscles producing elevation are superior rectus and inferior oblique, and the muscles producing depression are inferior rectus and superior oblique. There are two types of torsional eye movements, intorsion and extorsion. Intorsion is caused by the superior oblique and superior rectus, and extorsion is caused by the inferior, so inferior oblique and inferior rectus. If these concepts are not clear to you, I would request you to please check out my playlist on Squint, in which I have posted detailed videos on extraocular muscles and eye movements. You can check out the link in the description box below and also in the I button here. So there are 4 cyclovertical muscles in each eye: superior rectus, superior oblique and inferior oblique. Thus, an individual has 8 cyclovertical muscles in total, 4 muscles in each eye. Park's 3-step test is done to diagnose a single cyclovertical muscle palsy. So in Park's 3-step test, we find out which of these cyclovertical muscles is paralyzed or palsied. And this test is applicable only when a single muscle out of these 8 muscles is affected. If a person has paralysis or palsy of multiple cyclovertical muscles, that is more than one muscle, then this test would be considered invalid. It will not give us the correct result. In fact, there are many other conditions where this test would be considered non-applicable, and we will discuss them in the later part of this video. So coming back to Park's 3-step test, it is also known as Park-Belchowski 3-step test or Park-Helveston 3-step test. As the name suggests, it is performed in 3 steps, and the aim is to diagnose which cyclovertical muscle of the 2 eyes is not working. So in step 1 of Park's 3-step test, we check the 2 eyes in primary position to see that which eye has hypertropia. So what is hypertropia? Hypertropia is a type of vertical misalignment in which one eye is higher than the other eye. So here we can see that the right eye is higher than the left eye. This is right eye hypertropia. But if you call it left eye hypotropia, then that would also be correct. Hypotropia is when one eye is lower than the other eye, so it is the opposite of hypertropia. But why? Why is right eye hypertropia the same as left eye hypotropia? That is because when the patient fixates with his right eye, then the left eye would appear to be deviated inferiorly, and when the patient fixates with his left eye, then the right eye would appear to be deviated superiorly. So just by looking at the eyes in primary position, we cannot say which eye is the affected eye. So in the first step of Park's 3-step test, we check which eye is hypertropic in primary position, that is in the straight gaze. In the second step, we check which eye is hypertropic in which gaze, which horizontal gaze, the right gaze or the left gaze. And in the third step, we check which eye is hypertropic in which head tilt, right head tilt or left head tilt. When the eyes are vertically misaligned in the primary position, our aim is to identify which elevator or depressor of which eye is affected, which muscle is not working. The elevators of the eyes are superior rectus and inferior oblique, and the depressors are inferior rectus and superior oblique. So for example, let's call it clinical case scenario 1. If the right eye is found to be higher than the left eye, which means the patient has right eye hypertropia, then it would mean that either this eye's depressors are not working, that either the inferior rectus or the superior oblique, one of these 2 muscles is paralyzed, that is why the eye has gone up, or the elevators of the left eye, that is the superior rectus and the inferior oblique, they are not working, that is why maybe the left eye has gone down. If we consider the opposite situation, which is left eye hypertropia, so in this case, either the depressors of the left eye, that is left inferior rectus and left superior oblique, are affected, or the elevators of the right eye, that is the right superior rectus and the right inferior oblique are affected. And this also means that the remaining 4 cyclovertical muscles in this patient, they are working normally because their paralysis cannot explain this deviation in the primary position. So this is step 1 of Parkes 3-step test, in which we have eliminated 4 cyclovertical muscles. We have narrowed down our search from 8 cyclovertical muscles to 4 cyclovertical muscles. One of these 4 cyclovertical muscles is paralyzed, and we will need to perform step 2 and step 3 of Parkes 3-step test to identify that muscle. In the second step, we check the vertical misalignment, that is hypertropia in gazes. Right gaze is when the patient looks to his right and left gaze is when the patient looks to his left. To understand this step, we need to understand what we mean by field of action of a muscle. Field of action is the position of gaze in which the action of a single extraocular muscle can be isolated and tested. What does that mean? It means that when we abduct the eye and then elevate it from this position of abduction, then the only muscle that will elevate this eye in this case is superior rectus. The other elevator of the eye, that is the inferior oblique muscle, does not have any vertical action in abduction. And why is that? It is because of the angle at which these muscles are inserted on the sclera, which I have already explained in detail in my previous video on the actions of extraocular muscles. You can check it out if you wish to, but for now, this much information should be enough for you that superior rectus is the main elevator in abduction and inferior oblique is the main elevator in adduction. Superior rectus does not have any vertical action in adduction. The same thing also holds true for the depressors of the eye. Inferior rectus is the muscle that depresses the eye in abduction and superior oblique is responsible for depression in adduction. So in summary, recti have their field of action in abduction and obliques work in the position of adduction. So coming back to step 2 of Parkes 3-step test, in right gaze, the right eye is in the abducted position and in this case we check the actions of recti, so right superior rectus and right inferior rectus. And in the same gaze, the left eye is adducted and in adduction we check the action of the obliques, so left inferior oblique and left superior oblique. So in the right gaze, we check the actions of the recti of right eye and the obliques of left eye. And in left gaze, we check the actions of the recti of left eye and the obliques of right eye. So if the patient has right eye hypertropia in right gaze, like this, right eye is higher than the left eye, then that would mean that either the muscle that depresses the right eye in this gaze is not working, or the muscle that elevates the left eye in this gaze is not working. That is why the left eye is displaced down. The depressor of the right eye in right gaze is right inferior rectus and the elevator of the left eye in right gaze is left inferior oblique. Therefore, if the patient has right eye hypertropia, it would mean that either the right eye inferior rectus is paralyzed or the left eye inferior oblique is paralyzed. So from 4 muscles in step 1, we have narrowed down our search to 2 muscles now, one in each eye. Step 2 has helped us in eliminating right eye superior oblique and left eye superior rectus. The same way, we also need to check the vertical misalignment in left gaze. We can see here that there is no vertical misalignment in left gaze. Let's check another scenario. Suppose our patient has right hypertropia in left gaze and no hypertropia in right gaze. So in left gaze, the right eye is higher than the left eye. That would mean that either the depressor of the right eye that acts in adduction, that is the superior oblique muscle, is not working, or it could mean that the elevator of left eye in this case, which is left eye superior rectus muscle, that is not working. Therefore, if the patient has right hypertropia in left gaze, that would mean that either his right superior oblique is paralyzed or his left superior rectus is paralyzed. We have eliminated right inferior rectus and left inferior oblique. Like I said before, the aim of Parkes 3-step test is to find out which cyclovertical muscle out of the 8 cyclovertical muscles is paralyzed. And by the second step, we narrow down to 2 muscles out of the initial 8. So it is in the third step that we finally find out the muscle which is paralyzed and our problem is solved. So in the third step of Parkes 3-step test, we assess hypertropia in head tilts, right head tilt and left head tilt. This can get a bit confusing, so I want you to pay attention. We will first discuss what happens in a normal scenario. So in a normal scenario, when we tilt our head to the right, then our right eye would have the tendency to extort and our left eye would have the tendency to intort. But we don't want the image formed on the retina to tilt or rotate. So on head tilt, our vestibular system, which is located in the inner ear, it gets activated in order to correct these torsions. So to correct the extortion induced in the right eye, the vestibular system activates the intorters of the right eye, and to correct the intorsion of the left eye, the vestibular system activates the extorters of the left eye. We know that the intorters of the eye are the superior oblique and superior rectus, and the extorters of the eye are inferior oblique and inferior rectus. Therefore, this right-sided head tilt has activated the superior oblique and superior rectus of the right eye and the inferior oblique and inferior rectus of the left eye. These are the four muscles that are activated in right-sided head tilt. And similarly, what happens in left-sided head tilt? The right eye would tend to intort. So the extorters of right eye would get activated, right inferior rectus and right inferior oblique. And the left eye would tend to extort. So the vestibular system will activate the intorters of the left eye, left superior oblique and left superior rectus. Now coming back to our first case scenario, where we have narrowed down our search to two muscles, right inferior rectus and left inferior oblique. Suppose this patient has right hypertropia increasing in right head tilt. We have just learned that in right eye head tilt, the muscles that are active are right eye superior oblique and superior rectus and left eye inferior oblique and inferior rectus. And it is because of the imbalance between these four muscles that has caused hypertropia, because the other four muscles are not active in this tilt. By step 2, we are left with only two muscles, right eye inferior rectus and left eye inferior oblique. Of these two muscles, the muscle which is acting in the tilt in which hypertropia is manifesting, that is in the right head tilt, the muscle active in right head tilt is left eye inferior oblique. The other muscle, which is right eye inferior rectus, is not active in this tilt, therefore it cannot be responsible for this hypertropia. In fact, right eye inferior rectus will get activated in left head tilt, and as we can see, there is no vertical misalignment in left head tilt. Therefore, we can easily eliminate right eye inferior rectus from this equation, and we are left with only one muscle, which is left eye inferior oblique, and so our patient has a left eye inferior oblique palsy. This third step of Park's three-step test is also known as the Belchowski's head tilt test. I know that many of you are still confused at this point because we are talking about the torsional action in head tilts. How am I using that to solve a problem related to their vertical actions? So let's understand that as well. So when we examine the patient in right head tilt, the vestibular system tries to correct the extorsion of the right eye by activating the intorters, superior rectus and superior oblique. But in a normal situation, this does not cause any vertical deviation because superior rectus is an elevator and superior oblique is a depressor, and they balance each other out. Similarly, the vestibular system tries to correct the intorsion of the left eye by activating its extorters, that is the left eye inferior rectus and inferior oblique. Inferior rectus being a depressor and inferior oblique being an elevator balance each other out, and no vertical deviation is induced in this eye in a normal scenario. However, if this patient has a left eye inferior oblique palsy, the vertical action of left inferior rectus would be unopposed, and this eye will be pulled down, leading to a hypotropia. That is why this patient had right hypertropia on right tilt. This hypertropia will not be induced in left head tilt because the paralyzed muscle will not be activated on left head tilt. The muscles working in left head tilt are all normal and they balance each other out. I hope this is clear now. Let's go back to the second scenario. It was a case of right hypertropia increasing in left gaze, and we had narrowed down to right superior oblique and left superior rectus. Suppose this hypertropia also increases in right head tilt. So the intortus of right eye will get activated to correct the extortion, right superior rectus and right superior oblique, and the extortus of left eye will get activated by the vestibular system to correct the left intorsion, so left inferior oblique and left inferior rectus. By step 2, we had to make a choice between two muscles, right eye superior oblique and left eye superior rectus. As we can see, only right eye superior oblique is active in right eye head tilt, which makes it the muscle responsible for hypertropia. Therefore, our patient with right eye hypertropia increasing in left gaze and right tilt has right eye superior oblique palsy. First case was left eye inferior oblique palsy. Our second case was right eye superior oblique palsy. Let's discuss what happens when the other two cyclovertical muscles are also paralyzed so that we are familiar with each outcome. So scenario 3, the patient has left hypertropia increasing in left gaze and right tilt. Step 1, patient has left hypertropia, left eye is higher than the right eye, so either the depressors of the left eye are not working or the elevators of right eye are not working. So we are down to left inferior rectus, left superior oblique, right superior rectus and right inferior oblique. The other four muscles, which are right inferior rectus, right superior oblique, left superior rectus and left inferior oblique, we have eliminated all four of them. Step 2, this hypertropia increases in left gaze. So left eye is higher than the right eye in left gaze. So either the depressor of the left eye in this gaze, which is the left inferior rectus, is not working, or the elevator of the right eye in this gaze, which is the right inferior oblique, is not working. We have eliminated left superior oblique and right superior rectus. Step 3, this hypertropia increases on right head tilt. On right head tilt, the intortus of right eye would get activated, right superior oblique and right superior rectus, and the extortus of left eye would get activated, that is left inferior rectus and left inferior oblique. In the second step, we were left with only two muscles, left inferior rectus and left inferior oblique. Right eye inferior oblique is not working in this tilt, so the only muscle remaining is left eye inferior rectus, and this is a case of left eye inferior rectus palsy. Scenario 4, suppose the patient has right eye hypertropia increasing in left gaze and left tilt. So step 1, right hypertropia, right eye is higher than the left eye, which means that the depressors of right eye, right inferior rectus and right superior oblique, or the elevators of left eye, left superior rectus or left inferior oblique, one of these muscles is not working. The other four are eliminated. Then the hypertropia increases in left gaze. So the depressor of right eye in left gaze, which is right superior oblique, or the elevator of left eye in left gaze, which is the left superior rectus. One of these two muscles is not working. We have eliminated right inferior rectus and left inferior oblique. Step 3, hypertropia is increasing in left tilt. So on left tilt, the extortus of right eye would get activated, right inferior oblique and right inferior rectus, and the intortus of left eye would get activated. So left superior oblique and left superior rectus. Right eye superior oblique is not active in this tilt, so we can cancel it. So our patient has left eye superior rectus palsy. But how do we solve this quickly? Because in clinics or during exams, we are already so stressed out that who has the time to remember all these things? So now I will tell you a quick way to solve Parkes 3-step test. Again, we will use an example. Left hypertropia increasing in right gaze and left tilt. Which muscle is paralyzed? We draw the H diagram first for both the eyes. This H diagram represents the field of action of each cyclovertical muscle. So for each eye, in abduction, we have labeled the two recti because recti have purely vertical action in abduction. Superior rectus is an elevator in abduction and inferior rectus is a depressor in abduction. The obliques don't have any vertical action in abduction. In adduction, we have two obliques because obliques have purely vertical action in adduction. Inferior oblique causes elevation in adduction and superior oblique causes depression in adduction. So step 1, left hypertropia. So either the left eye's depressors are not working or right eye's elevators are not working. Increasing in right gaze, you don't have to think about which muscles are acting in this gaze. Just select the muscles that are written on the same sided gaze. so the right gaze of this person. The two muscles on the right gaze are right superior rectus and left superior oblique. Step 3. The hypertropia increases on left tilt. You will notice that by the end of step 2, you are left with two muscles. Either both of these muscles are superiors, so one superior of each eye, or both of them are inferiors, so one inferior muscle of each eye. You will never face a scenario where the two muscles remaining in step 2 are a superior of one eye and an inferior of the other eye. So in this case, in step 2, we are left with two superiors. The mnemonic to remember here is that S stands for same side. If the hypertropia increases on left tilt, then the affected muscle would be left superior oblique. Why? Because as per the mnemonic, S means muscle on the same side. Means the affected muscle is on the same side of the head tilt in which the hypertropia increases. Suppose it was the opposite head tilt, that is left hypertropia increasing on right gaze and right tilt. Then our answer would have been right superior rectus because the muscle on the same side as the head tilt is right superior rectus. Let's take another example. Left hypertropia increasing on left gaze and left tilt. So step 1, left hypertropia, so the depressors of left eye are not working or the elevators of right eye are not working. Step 2, increasing on left gaze. Muscles acting in left gaze would be the muscles written on the left gaze of this person or the left side of this diagram. So left inferior rectus and right inferior oblique. Step 3, hypertropia increases on left head tilt. So here we are left with two inferiors. Our mnemonic was S stands for same. So I would be opposite of that. Therefore the muscle affected is on the opposite side of head tilt. So if hypertropia is increasing on left head tilt, the muscle affected would be right inferior oblique. Last example, right hypertropia increasing on left gaze and left tilt. So step 1, right hypertropia, so we mark right eye depressors and left eye elevators. Step 2, increasing on left gaze, so we mark the muscles in the left gaze, right superior oblique and left superior rectus. Step 3, hypertropia increases on left tilt. We are left with two superiors. S means same side as the head tilt. So left superior rectus. Simple. So what are the conditions in which Parkes 3-step test would be inapplicable or invalid? Means we cannot perform Parkes 3-step test in these conditions. It will be inconclusive. First, in case of multiple cyclovertical muscle palsy, means two or more muscles are affected. Remember that I am talking about cyclovertical muscles. If the horizontal recti are paralyzed, then Parkes 3-step test can be performed, provided only one cyclovertical muscle is involved. Second, it cannot be performed in restrictive squints like thyroid ophthalmopathy, Duane's retraction syndrome, Brown syndrome, orbital fractures with muscle entrapment, etc. Third, it cannot be performed in dissociated deviations, basically dissociated vertical deviation. Fourth, it is invalid in cases of resurgery, in those patients who have had one or more cyclovertical muscles already operated upon previously. Fifth, in cases of skew deviation. And lastly, this test would be inconclusive in myasthenia gravis. Recently, step 4 and step 5 have also been added to this method. To tell you in brief, in step 4, we do the double Maddox rod test to measure the amount of torsional deviation, and in step 5, we examine the deviation in supine position to differentiate between skew deviation and superior oblique palsy. I will cover Maddox rod tests and skew deviation in separate videos, sometimes maybe in the near future. This will be all for this lecture. Please like and share this video with your friends and colleagues if you found it useful. And please subscribe to my channel to support free education. Thank you very much.